Hey, Danny Matei here with PT Biz, and we're in Dunwoody, Georgia, visiting Daniel Bodkin with ProActive Athletic Performance. He's got some amazing equipment, a really cool skill set, and more of the sports science side of things. So we're gonna check out everything he's doing here and show off his practice. This is gonna be an interesting clinic tour because this is different than probably any clinic we've ever been in, where you're really working with patients, but also working as an adjunct to other providers to help them with the rehab process with some of this unique knowledge and equipment that you have.
We were in an MBA event last summer, and people were saying, where's your practice? And I was like, well, I don't have a practice yet. And then we realized, it's time for me to take what I'm known for nationally with isokinetics and return to sport testing and get a local presence.
Yeah.
And my thought was, I definitely wanted to go the cash base. I've been out of the insurance business for a while now. So I wanted to keep it cash based. So how can I have my niche of isokinetic ACL return to sport, but also keep it, in that cash practice? So decided to make it more of like setting up like a research lab that we could also be an adjunct to all the local clinicians here in North Atlanta. So when they need to get their athletes tested, they can send them to me and I can do all their return to sport testing, provide them with the data, and then they can in turn give that to the doctors. Yeah. But then when their patients are discharged from their insurance plan at 5 months out, we have what we need to be able to finish the job, what I call the final phase of ACL. The nice thing is when a lot of people stopped using these machines in the US, the guy who was my mentor when I was in Tampa, he stayed with it. So then when the technology improved in the early 2000s, I just happened to be at the right place at the right time with this new company, CSMI, that said, okay, well, what can we do? We know what they could do in the 70s and 80s, but with this new technology, what can they do now? Mm-hmm. So we've been developing the software and the machines ever since then.
The ability to effectively use one of these machines to interpret the data and then to apply it to the sports or whatever they're trying to do, that's a really rare, difficult thing to learn. What you're seeing, why you like these, like what kind of equipment this is, and how you're utilizing it with people that come in.
Well, there's a big barrier to entry. One is the cost.
For sure. Like what are we talking like we're looking over here in this corner, the average person that doesn't work for this company would be about how much?
$50,000 just for the isokinetic machine. You can get a refurbished one for a little bit less expensive.
Yeah.
And even the force plates, they work on a, where you pay every month. You can't just buy it outright. But so it's pretty,
it's for them.
It's costly. So that's the main barrier to entry. The second is, okay, now you have a machine, how do you use it?
Yes,
I was a tech, a PT assistant all through PT school. Yeah. I was an athletic trainer while I did it. So 2 nights a week, I was just setting up, the Cybex on one side, our KinCom, I'd set that up for a left knee. So I'm just doing setups, wiping down tables for 3 years after I got done with PT classes. So by the time I became a PT, I'd already been with the equipment for the last 4 years. So my training, I was at the right place at the right time. But I actually made a CEU course to teach people how to use these with the modern techniques.
Oh, cool.
So if you can get over the price, you can get somebody trained up on it. And then the third thing is, okay, what do you do with that data?
Right, exactly.
Yeah, because if you don't have it, you're hop testing, you might have like an inline dynamometer. And my saying is, if you're not testing, you're guessing.
Sure.
And so it's applying this to find what are those final weak links. If somebody's, 7 to 8 months out of their ACL surgery, and you can, they might be there, they might meet all their body weight metrics, their balance metrics, but when they're not, now you have a way to zero in.
That makes total sense. Let's take a look at this thing for a second, because this is, like I said, this is interesting. This is one of the few places I've seen this outside of a university, a pro team, or a lab, right? Like, I don't know many that are not in it. So aside from looking at ACL tests, and obviously you can look at like knee extension and flexion and control and all that. What else is this really useful for the clients you have coming in? Like, what other things are you seeing that this is like really helpful for the rehab process?
Yeah, so everybody thinks of this as a knee machine.
Totally, I think of it as that,
Man, this is really good for ankles and shoulders.
Really?
Oh yeah, I mean, you're 2 to 3 times stronger for both the ankle and the shoulder when you're at one end of the range of motion versus the other.
Oh, okay.
All right, but on an isotonic machine or with a band, we're having to load you to your weakest point.
Yes, right.
Whereas on these machines, they're able to adjust the load throughout. So you're really challenging the muscle throughout its entire range of motion. So whether it's you just sprained your ankle, you just had a rotator cuff repair, a slap repair, or something with your knee, we can load you up heavy at the end, get you strong. But we also have really early on things, so we can run you through a CPM just to help get that the neurologic system to calm down from its pain, from swelling.
When people come in to work with you, if they're working through a plan of care, how are you incorporating this with them as far as like the treatment options they have? Like what does that typically look like if somebody came in and you wanted to use this as part of the rehab process?
Typically, once they'd come in, we'd actually start right over here.
Yeah.
Got to do your big movements, your compound, your squat, your hinge, your lunge, any of your plyometric and agility. You're going to do all that stuff first.
Right.
And then you're coming over here at the end to isolate. So in an hour-long session, they might be on the machine 15 to 20 minutes.
Okay.
If your upper extremity, it's the same thing. We got you over there. You're going to be on the table, starting with your scapular work, thoracic work, and then your upper body pushes and pulls, and then we're over here to isolate your rotator cuff.
How do you balance staying up to date on the technology, the research, but then you've got the business side of stuff you're learning, the marketing, the actual putting everything together here. Like how has it been juggling all that while also you have a family, young family?
I have a really good team at home.
Yeah,
that's the first one.
That's good.
All right, my wife, she's a champ.
Yeah, but she's not exactly like she's an oncologist.
Yeah, she's an oncologist, so she's running the show there and having her own set of patients. So we work really well as a team.
That's cool.
That's a big part of it. We fill each other's gaps and help each other out. And then I am wearing a lot of different hats.
Yeah.
And I think being in the military has prepared me for that.
What are your kind of go-to things that you feel like, man, I use these with 80% of the people that that I end up working with?
Oh yeah. First of all, I'm a big believer in barbell medicine.
Yeah, loading them up, sure.
Your big movements. So whether it's lower extremity or upper, you're going to get some barbells, some dumbbell, kettlebell, right?
Yeah.
One of the pieces of equipment I really love is the shuttle.
Yeah.
So actually, I found this before I even moved to Atlanta, and I've had it in storage. I just love this equipment that much. So if somebody's coming to me early on in the rehab and they can't squat, or before they can jump, I can have them on here loading up, whether it's squatting or getting into the plyometrics before they can safely do it on land. But then we can even load them up. This one goes all the way up to 700 pounds.
How much of what you do is strength and conditioning? How much of what you do is going to be hands-on stuff? Like, what's your approach with that?
I love hands-on, whether it's instrument-assisted cupping or just manual work. Big believer in that. Being an athletic trainer, I'm still a big believer in E-stim.
Yeah.
And a lot of people poo-poo on that, but I've strained my hamstring before. I've had fractures in my foot. I know because I've been there, so I'm a big believer in it. So I'll pull that out when I need to.
Yeah.
But the biggest thing is once those symptoms are down, how can we then load you back up?
Yeah.
And people in general do a really good job of on the table rehab. I'm a meathead at heart.
Yeah.
So I'm working with athletes. I want to get them back, to whatever load that they can do safely that kind of mimics, all the different movement patterns. So as quickly as they're able to, get into, any the continuum of rehabs, in training.
Yeah.
I don't think it's, one or the other. I think it's a big continuum. So as quickly as I'm able to move them along to that, I really liked it.
Yeah.
So a big thing for me was when the kids are home from school, whether the school is closed or they're sick, they need to have a place.
Yeah.
And before I moved in here, they would just go to my clients' homes with me.
Yeah.
But so I needed someplace with an office big enough that I could accommodate them. But I still have space for another clinician, for another desk. So that was really important to me, was to have that space for that.
To be able to make it fit whatever your life is, that's the whole point of a fucking business.
Yeah.
Right? It's just like build the business to fit your life. Don't let the business become your life, which sadly is what most people do. So for you, if you're like, no, I need a space that my kids can hang out in, they can color and whatever else, right? It's like, you can separate it a little bit if they're, here while you're working. Like, I love it. I think that's great.
I also needed a space for education, because I still do a lot, once somebody buys a machine, and then I get them trained up on it, kind of onboard them. So I needed a space that I could, I use this more for filming than I do for an office. And you can see I still have some of the notes from from last time up there.
Yeah.
Right.
No.
So I needed a space that could also accommodate the education side.
Right.
So I'm not just, you know, in a closet somewhere.
Right. Exactly. Yeah.
Gets me out of from doing it at home. But I really wanted to make it me.
Yeah.
So, you know, instead of buying artwork, I just used the mosaic of the kids' artwork.
I think this is awesome, man. I think it's really cool. I'd like to know, you know, we always ask people this, like, hey, 5 years from now, you know, if you can call your shot and say, hey, this is what, you know, this practice is going to look like. What would you say is an ideal outcome for you 5 years from now?
I'd say 5 years from now, whether it's this location or something slightly bigger, I want to stay kind of local to the Atlanta area.
Yeah.
But I educate people on how to do this, so I would love that this is kind of like an education center.
Yeah.
So you can kind of, you know, come work for me, learn the ways, you know, how I do with isokinetics, and then you can take that on somewhere else.
Yeah.
So, you know, if there's ever room for expansion, it would be kind of in that aspect, is helping other people kind of, you know, take what they've learned from me and move on, much like what I did with my mentor, John.
Totally. No, I like that. That's cool, man. Well, we got the video to prove it. You can look back at this 5 years from now, see where you're at. We really appreciate your time. We'll finish it there. Guys, I hope you like this one. This is a really unique clinic. This is something that we were really excited to show off. And I think, you know, as you educate more people, it is interesting to see how this is going to kind of fit into, especially the post-operative world. I feel like it just makes so much sense with, you know, being able to be more accurate with what we're doing with them. So I hope you like this one. Keep watching. We got some full clinic tours coming up, and we'll catch you in the next one.